The Importance of Goals of Care Discussions for Healthcare Providers, Patients, and Their Families, produced by Ben, Samantha, Lindsay, and Joe. Although advanced care planning is relevant for everyone, determining goals of care may not be pertinent for all patients. Advanced care planning is for the event that an individual is no longer able to make their own healthcare decisions. This is the what if something happens stage. It includes advanced directives and substitute decision makers. Goals of care is the what if this happens stage. The individual now has a life-threatening illness but is stable. Finally, at the moment an event happens, all this information can be used to make decisions that respect the patient's autonomy and values. Joe is a 30-year-old man who has been diagnosed with terminal colorectal cancer. He has already worked with his healthcare providers and lawyer to create an advanced care directive. His nurse Ben has also discussed his prognosis in detail. Clear discussion of prognosis, treatment success rates, risks, and benefits are important to ensure the patient has all the information required to make informed decisions about goals of care. Prognosis and goals of care should be discussed in separate meetings because it is important to not overwhelm the patient with information. Nurse Ben is thinking about a meeting with his patient Joe coming up this afternoon. He knows Joe is stable now, but also knows that his condition will worsen. Ben asks himself, would I be surprised if this patient died the next year? When he answers no, he knows this is the trigger to discuss the goals of care. Like most healthcare providers, Ben is hesitant because he knows this is time-consuming and does not want to increase Joe's anxiety, depression, or cause him to lose hope. However, he knows that research suggests this is a myth and that these discussions are welcomed by patients. They also contribute to increasing patients' quality of life, foster trust in the healthcare providers, and reduce burnout and costs. Here's how a conversation about goals of care may look.
It must be frightening to think about your future. Tell me, what are you most worried and afraid of?
Truthfully, I'm not afraid to die. But I am afraid of what would happen to my dog Harper. I don't have any family and she's all I have.
Your love for Harper is remarkable. I can tell she means a lot to you. What I wanted us to talk about today is your goals of care. We've already talked about your health condition, and we know it's inevitable that your disease will worsen. If that happens, what's most important to you?
I thought we discussed this last week. Advanced care plan, or whatever you call it.
I can see how that would be confusing. Let me clarify. Advanced care planning is more of a broad template. The goals of care are more specific to your current illness and your situation now. With the goals of care, we will look at what's important to you with the time you have left.
Goals of care discussions are important to have with patients. They decrease the risk of these patients being subject to undesired interventions when they reach end of life. Currently, because these conversations are not being conducted, patients are increasingly exposed to unwanted interventions. Studies have determined that technology-laden end-of-life care is linked to a decreased quality of life in patients and a lower level of patient satisfaction with care. These negative outcomes are further reflected on family members involved, causing them to experience depression and anxiety related to their loved one's end of life.
Yeah, basically I just want what's best for Harper. That's promising because my friend Samantha says she'll take good care of her. And Samantha's actually getting married and I don't want to miss out on that. For me, I don't want to be resuscitated and I want to be pain-free as much as possible.
It sounds like you have some goals here. Are there any abilities you can't possibly live without?
I never really thought of that before. I guess I'm worried about depending on other people, and if I continue to get worse, if I start to feel more tired and weak, how can I shower, cook, clean, shave?
So if it gets to that point, we need to talk about treatment and how much you're willing to go through to make it to Sam's wedding.
That's really hard to think about. If it gets to the point that I can't take good care of myself anymore, I don't want to live like that.
That's understandable. Based on our meeting here today, I've identified 3 goals that are important to you. Firstly, it's important that Harper gets cared for. Secondly, you want to make it to Sam's wedding. And finally, you value your independence, and it's important to you that you're as pain-free as possible.
Yeah, that's right.
In summary, it is relevant to discuss goals of care when an individual is diagnosed with a terminal illness but is still stable. This discussion includes functional abilities, what's important to the client with the time they have left, and the treatment trade-offs to achieve these goals.